Hawaii lawmakers introduced several bills in the current legislative session that would legalize limited amounts of marijuana for recreational use. One bill cites the potential for economic growth and increased tax revenue to help the state meet its strategic goals, while others note the growing national trend to legalize recreational marijuana usage. The proposals elicit strong opinions from both sides of the issue. Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha, and welcome to Insights on PBS Hawaii. I'm Daryl Huff. The marijuana movement has caused a deep divide, but in recent years, a majority of states, including Hawaii, have reformed laws targeted at cannabis. Medical use marijuana is legal in Hawaii, and last year a law that decriminalized smaller amounts of pot went into effect. This year, there are a handful of bills moving through the state legislature, including one to legalize recreational marijuana for adults. Our panel tonight includes guests who are both for and against the proposals. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Claire Connors is the Attorney General for the state. She was appointed by Governor David Ige in 2019. Prior to this post, she worked as a lawyer in both the public and private sectors. Democratic State Senator Carl Rhodes represents District 13, which includes Nu'uanu, Paoa, Liliha, Iwalei, and Chinatown. He is the chair of the Senate Judiciary Committee. Republican Representative Val Okimoto serves District 36, which includes Mililani and Mililani Mauka. She is currently the House Minority Leader. And Nikos Leverans is the board president for Drug Policy Forum of Hawaii. The nonprofit works to educate policymakers and the public on effective ways to address drug issues. Let me start off with you, Mr. Leverans. What is the logic of decriminalizing marijuana? You're the one who's got to make the harder argument here, because the law would have to change, obviously. But what's the value to society of legalizing this drug?
Well, first, thank you for having me. Great to be back with you. I think that 8 decades of the war against cannabis, like the larger drug war, is a tantamount failure. People do not stop using drugs. What we've seen is a system of mass incarceration and criminal justice supervision and control that impacts so many people, particularly Native Hawaiian communities and people who are impacted by social determinants of health. Cannabis is far less deadly and far less injurious to individuals and to society than alcohol and tobacco. Alcohol causes 95,000 deaths per year. Tobacco causes almost 500,000 deaths per year. And each has about 300 billion in costs related to healthcare, lost productivity, and others. So cannabis, compared to those substances, is safer, and it is less injurious to a person's health, and it will cannabis legalization will help ensure that Native Hawaiians and other impacted communities will have an opportunity to participate in the emerging cannabis marketplace.
Okay, let me ask Attorney General Claire Connors. You're probably the strongest voice against this. What's your concern about legalizing marijuana? I mean, I think a lot of people think it's a pretty benign substance.
Right. Well, thank you, Daryl. Nice to see you. And it's a delightful moment to be on the panel with everybody here tonight. So just to step back, because you are right. In my role as the Chief Law Enforcement Officer, I represent law enforcement, and law enforcement does have quite a bit of concern about the legalization of marijuana, in large part because there is still not enough science or data out there as to how it's going to affect safety on the roads, how we're going to be able to devise metrics for impairment. We don't have a blood alcohol content type of metric to use for our safety sobriety tests on the roads. We have a lot of work to do to figure out how legalization, as it rolls out, is going to impact the role our officers have to play when they come upon a situation where someone who is impaired has caused an accident or has caused some kind of a crime situation or other situation of concern, and how they go about making a case so that people who are misusing marijuana can be held accountable and what that means. We also have a lot of concern about how we're going to keep marijuana out of the hands of youth. We know that there's still a lot of science that needs to be conducted about how it affects the development of the brain. But more importantly, we do find that when somebody comes into the criminal justice system, that is usually the moment in time where they get treatment. If they have a problem, some kind of addiction, then that's the moment where we can handle it. So we're concerned about decriminalization as well as legalization.
Senator Carl Rhodes, the Senate is apparently taking the lead on this issue. You've got a bill that I think, have you moved out of your committee already, that would legalize recreational marijuana? And how are you balancing these different arguments?
No, well, there is a bill that's still alive that is in my committee, and it's joint with Ways and Means, and I believe we're going to hear it. I don't think we've finalized it yet, but I think it's going to happen. Not hear it, but do decision making on it. Yeah, I mean, I think that probably where I differ from the Attorney General is that we have quite a lot of experience already with dealing with Pakalolo, because it's basically universally available now, and we already have to deal with the consequences on the roads, and we already have to figure out how to treat people. I had a 10th grader, I used to represent the area around Farrington High School. I had a 10th grader out there say, "Oh yeah, I can get pot anytime I want." So I think, in fact, for me, that's one of the reasons I think we need to regulate and tax, because I'd rather have a situation where a substance that isn't, it is a problematic substance, it isn't particularly good for you, and but you know, the question is how you're going to manage it. And right now, I agree with Nikos that you know, Green Harvest, it's still 100% available, so we need to try something different.
Representative Valocabota, you're both a Republican representative and also a mom. You know, what do you bring to this conversation? What are your concerns about legalizing marijuana?
Yeah, thank you again for having me on the show. And you know, before I was a legislator, and even now that I am, my first duty is a mom. And so, as a mom and as a former educator, I have great concerns with this bill. I voted in opposition of the decrim of the marijuana when we had it that came across the House floor. You know, as a fiscal conservative, I always weigh the cost benefit, and I have to agree with A.G. Connors that there's many negative things that can happen. To me, the legalizing marijuana creates steep costs for our society that will not be that will far outweigh the tax revenue that we got from it. You know, I can't imagine. I still go to the classrooms when I can. I substitute when I can. I can't imagine our keiki being exposed to this. There's still lots of research that shows that a child's brain, our youth's brain, is not fully developed until the age of 25. That'll be 4 years after, you know, legalized marijuana will be allowed at 21 years old. That should be allowed. There's evidence of showing how it affects their cognitive learning, evidence showing how it affects a lot of their skills, short-term memory, even motor skills, coordination. All these things affect their keiki. And being a mom of a 13-year-old and an 8-year-old, I have great concerns. You know, to me, it doesn't make any sense to say that we're going to legalize this to get the revenue based on what's happening already, and not really think about the negative impacts that it will have on her youth. Let me
ask Nico Leverance from the Drug Policy Forum, what's been the experience of other states? How many other states have done this, and have these concerns actually played out, the ones that are being brought to our attention by, you know, Representative Okimoto and Attorney General Connors?
Officially, 15 states are now adult use states, but 4 of those states, South Dakota, Montana, Arizona, and New Jersey, just came on board last November with these election results. And what experience has shown in Colorado, for example, which was one of the early states to legalize, is that there hasn't really been much of an impact on either the roads or the youth. JAMA Pediatrics found that there was actually a bit of a decline in adolescent use of cannabis after legalization. And when we're talking about impact on youth, we have to think about cannabis as a Schedule I drug, and being on Schedule I is really problematic because it impedes scientific research into cannabis. So I'm very happy that the legislature in 2019 passed HCR 89, which calls upon Congress to deschedule cannabis and to also to provide safe banking services for cannabis-related businesses, which I know that the Attorney General has issued a letter of support for.
Let me turn to the Attorney General. Our first question from a viewer. Ms. Connors says, not enough data available. How about looking at data from states where it has been made legal? What calamities or positives have occurred? And also, if you'd like to respond to Mr. Leverins about what is the experience in other states from your perspective.
Sure. Let me start with the Schedule 1 issue. That is another issue that we've raised as well, right? Federally, this is still an illegal substance. So we do raise concerns about the fact that there could be confusion, but the fact that the feds might be moving in a certain direction might create some more synergy in the future. But right now, Schedule 1 and the fact that this is still federally a problem and illegal creates issues for us as a state. But yes, the data that I see coming out of Colorado, which I believe was the first state to legalize in 2012, is quite alarming. We've got data that talks about marijuana-related traffic deaths having increased 151%, while all Colorado traffic deaths increased by 35%. We have Rocky Mountain high-intensity drug trafficking data that reports that I believe I just said too, that marijuana-related traffic deaths increased by 109% after legalization. We saw similar type of trends in Washington since legalization. 39.1% of drivers admitted to driving within 3 hours of using marijuana. Part of the concern is that we don't fully understand how certain dosing of marijuana affects people's ability to drive, right? We have a pretty good sense of how it works when it comes to alcohol. And that's why we have blood alcohol content levels, 0.08 and others, but we don't have that. And so we are starting to see in some of these early adopter states data that's coming to us from our federal traffic and our federal Department of Transportations that raises a lot of concern, especially for law enforcement.
I want to give you an opportunity to follow up on the other thing that Nico Leverins says about the amount of people whose lives are affected by the law enforcement of this substance. People, jam jails and so on. In Hawaii, in particular, do we have a lot of people going to jail for marijuana?
That's my understanding is that's not the case. I know on the federal level that is not a priority prosecution in terms of user amounts, right? That's something that might be if you have another set of criminal charges brought. Possibly there might be a marijuana charge that makes sense to add onto it, but it's not usually a primary charge in the federal system. And there have been a number of memoranda that have been issued by the federal government that outline how the federal prosecution happens. On the state side, my understanding too is that it's not so much that we're putting people who are doing user amounts or who are trafficking at low levels as a main target of what law enforcement is after. And of course, in 2019, we did have decriminalization. So 3 grams or less, now you will have to pay a fine and you won't be entered into the criminal justice system at all. So we don't see that it is a hardened area of prosecution or investigation right now.
Senator Rhodes, if you want to respond to any of that, go ahead. But I'd also like to get into a little bit of what is the incentive and what is the money piece? Because we've talked during the introduction and we've heard that, maybe this is a good year because we need money. How would this government get money out of the proposals that are out there now?
Well, I think there is a money piece to it. It is if we regulate and tax, there'll be tax money coming in. I mean, it's always a tricky question because if you tax it too high, it just drives people back into the black market anyway. But it's not a home run. At least the figures I've seen, it's not a home run kind of dollar amount. I've heard maybe $50 or $60 million. The numbers are changing and getting better for the state budget right at the moment. But when we really thought things were going to be bad because of the pandemic, we were looking at 1.4 billion a year, as I recall. And so $60 million. Well, it's better than a sharp stick in the eye, but it's not going to solve the whole problem. So I view it more as probably the paradigm I look at is cigarettes. So we tax cigarettes pretty heavily, but then we turn around and spend quite a lot of that money on education about the evils of cigarettes. And there are certain situations where using Pakalolo is beneficial. That's why we have a medical marijuana program, but it has its downsides, and especially for younger people. So again, I come back to we need to manage this as smart as we can, and I don't think we are right at the moment.
Representative Okimoto, your thoughts on that, the money part? I mean, if they don't get money from marijuana or something else, they might tax something else, and you don't want them to do that either, right?
Correct. And usually I'm not one for, excessive taxation. I realize that we are in a year coming off of this COVID pandemic, and we're still in it. And I realize I'm not naive to the fact that we, as a government, we need revenue. But I think to use this example as we're going to generate revenue is incorrect. For the tax foundation, I think their estimated tax revenue that they're going to generate, that we plan to generate, is about 28.5 million. But our total budget is about 15.52 billion. That's less than 2%, less than 0.2%. And Colorado is the first state that did it in 2012. And so we have the most data for back to Colorado. I believe, their fiscal year 2019 operating budget, they brought in about, the tax revenue from marijuana represented about 0.85%. So less than 1% of their revenue was generated from marijuana being legalized. And for me to, we know that we're not going to generate revenue right away. We need, to find money now. If this happens, it takes 2+ years. And even when it does come to fruition, the research has shown that it's not going to be anywhere near what we need. So to me, again, the costs outweigh the benefit, and to me, it's not worth it. Colorado has been, I think they're top 3 right now for the most successful states, behind Washington and California. And there's still, I haven't seen research that shows that the projected revenue brought in has been met with what actually has been brought in.
Okay, let me ask Nico Leverance, make the money argument for us. What do you see as happening? And it sounds like the money part has been disappointing in other states. Do you agree about that?
Well, when we talk about potential revenues, that's one part of the equation, but we also have to talk about high quality jobs that will be created in the agricultural sector, in the distribution sector, and in so many other areas where, Hawaii will become a premier destination and a premier brand on the global cannabis industry. Another thing to consider is that ending cannabis prohibition will effectively end, hopefully, the arrests of 1,000 people per year in this state who entered the criminal justice system. So in effect, cannabis is a gateway into criminal legal system involvement, and it keeps people trapped in probation and parole. We have the highest average term of probation in the nation at almost 5 years, and because cannabis can be detected about a month after even casual use, one-time use, this is problematic. So in terms of foregone costs of incarceration and costs to the criminal legal system, adult use cannabis is a win-win, and that it will only generate about $25 to $30 million in the initial years. I don't think we should be necessarily poo-pooing that, given job creation.
Let me ask though, by putting the argument that way, it sounds like you're saying that really money is not the reason for doing this. You're mostly supporting this because of the criminality issues and the
Sure.
overemphasis on enforcement. Is that fair to say?
We approach it primarily as a health issue and also as an equity issue. Right now, we have a kapakahi system where substance use is treated largely through the criminal legal system while not affording people meaningful opportunities of community-based treatment upon demand because money is tight. We understand that money is tight. So we stand foursquare with the American Public Health Association, the Global Commission on Drug Policy, and others who say, hey, we need healthcare. We don't need more jails and prisons. We don't need to criminalize more Native Hawaiian youth, which is still the case, 300, about 300 to 400 per year.
Let me stop for a second and go back to the senator and representative on this, because I think that one of the things that happened this year was partly because of a money argument. It was the first sort of serious conversation I've heard about gambling in the legislature for a while. I think that Senator Rhodes, I think you've got a lottery bill in front of you. The reason I'm asking is that there was a question from a viewer, Janelle, on Facebook. Yes, we already got criminal activity, may as well provide jobs and bring gaming out of the back rooms, bringing up sort of the idea that we already have these vices what shouldn't we just be regulating them instead of and taxing them instead of trying to wipe them off the face of the earth, which we're never going to be able to do? Representative Oki, how do you respond to that? The idea that you're not going to stop it, you might as well tax it, you might as well regulate it.
I have that argument presented to me quite often. I mean, personally, I don't. I'm not a proponent or supporter of let's encourage bad behavior by just normalizing it. That's not something I'm in favor of. But I think what we need to understand is many times we're not completely educated with what the facts are. And when you look at the legalization of marijuana in other states, you realize it's not as clear cut. It's not as the benefits aren't going to be that clear. They're not going to come right away. Maybe not at all. We talk about law enforcement. AG Congress mentioned that it's still federally not legal to do this here. So we're putting our law enforcement in great danger. I spoke with an HPD officer this week, and one of the things he shared was they have great concern that they're not equipped for this. They, being able to assess somebody and if they get arrested, they can't. They're not trained. It's different from a DUI where there's tools, a breathalyzer, a blood test where you can assess whether this person has that substance in them. But marijuana is not. For them to now be expected to go out and assess and figure out, if somebody is under the influence of marijuana, that's a big thing. And so that's going to be more money that we have to invest and more training. And already we know that we have a shortage of law enforcement officers. To put this on them all of a sudden right now, it's a great concern of theirs. So I know that many people think it's already happening, just allow it. But to me, again, the benefits do not outweigh the cost.
Senator Rhodes, what are your thoughts about that? Do you think that these things are going to be inevitable and it's a matter of, getting ahead of the train a little bit?
No, I don't think it's inevitable. I do think that, we're talking about compared to what? Pakalolo is already 100% available in Hawaii. Anybody who wants to buy it can buy it. So, this notion that somehow if we just keep it illegal, no one's going to be able to get it, and all the negative effects, which there are some, I admit, all the negative effects are going to be taken care of because we're just not allowing it. Well, that's just not true. Anybody can get it. So that's why, you got to manage a problematic substance. I class it in with like Nikos does with alcohol and cigarettes. And if I was just going to ban one of them completely, like if you could just get rid of it, it would be cigarettes. Cigarettes kill hundreds of thousands of people every year. It wasn't until like a month ago that the COVID pandemic had killed more people in the last year than cigarettes had killed in the United States. So I think it's wishful thinking to say that, oh, well, if we just keep it banned, there's no Pakalolo problem. There is a Pakalolo problem. We have it right now. The difference is, of course, is that we don't guarantee the quality of it to anybody. There's no consumer controls, and there's no money coming in from it to the government to provide for education for what the bad effects are, like we do with cigarettes. So I think it's just unrealistic to think that, well, if we just keep things the way they are, everything will be fine. No, if we keep things the way they are, everybody's going to be able to get Pakalolo.
Okay, so Attorney General Connors, I see you
fairly
vigorously trying to respond to that. Go ahead.
No. First of all, not everyone can get it right now, right? It's not something that is, you can't walk into like you can to a liquor store and get it. It is still something that is not available to kids on a Friday night who want to try to, go into a recreational area and get the drug. I mean, not to say that it's not available through certain illicit venues. It certainly is. And that's why, as Nico said, we have, I think, 1,000 kids in 2017 came into the system, were treated, I should say, received treatment, like Nico's also recognized, but it's not something that is widely available, and that will change. So then that leads me to the other hat that I wear, which is the chief legal officer, where we try to work with the state agencies to see what a regulated system might look like, right? And we've got medical cannabis. That was a very massive build out for the Department of Health. Just to be very clear, that is a very, very tightly run ship but it's a huge build out. So it's a lot of effort because it's vertical, right? From the very beginning to the very end. So if that's what we're looking at, then we really need to think about what it is going to be in terms of the resources that the state is going to have to put towards that. What is the Department of Ag going to have to do? Is it, I see that in some of the bills proposed, it's the Department of Taxation. A lot of other states, when they did this, they did it by ballot initiative. So then the government had to figure it out after it was already legal. And that wasn't really a great idea. You know, 2019, we got a task force put together. Senator Rhodes is on the task force. That's kind of a better way because we can think through what the regulation looks like. And there's a lot of questions: zoning, taxation, impairment measurements, dosing, age limits, how we're going to license it, even possibly the question of should it be state or county. Right now, liquor is done through the county, and you can see some states have done that. They've added to their liquor departments, liquor and cannabis. So we have a lot that can be learned from how other states have regulated this, but we really need to think about what kind of build out it is going to require of the state agencies and who it would be involved in that conversation.
Can I ask a quick question on that? And then I got to get to some of these questions because the viewers are starting to pay attention. Does our medical marijuana system that we have now pay for itself? That is, the fees and charges against the dispensaries and so on, do they cover all the costs of the regulations? And do they bring money, does that industry bring money to the state? Because I think that was part of the promise, wasn't it, Claire Connors?
I actually don't know. That would probably be a better question for the Department of Health or maybe one of the legislators who might be, or Nikos, who knows?
Yeah, okay, Nikos seems to be nodding his head. Go ahead.
Well, what we've seen persistently from the Department of Health is the need for more staffing and more resources. And the medical cannabis market here is very limited. I believe it's only about 30,000 registered patients. So yeah, there needs to be more provision of oversight, regulation, and education. And not just for medical, but also for adult use, and that I trust that families will make, decisions, like moms like that, Representative Okimoto will be able to govern, the conduct of her children and her household. But as a matter of policy, we need education. We need science-based education for everyone, adolescents and adults. I mean, you can get very, very impaired if you're not careful. And people who are start low and go slow. Start with 2.5 grams or 5 grams of THC. Don't start with 50 or 100 because you'll be, catatonic. And nurses can figure out, how the Canadian nurses put out harm reduction materials
Okay,
to educate
thank
people.
you. I gotta do these questions.
No.
We're about halfway through it. I've got a bunch of questions. Senator Rhodes brought up the choice of evils here. I'd rather get rid of cigarettes than marijuana, basically. But if you we got two questions here. One from Terrence, one from Valerie. Both saying essentially, it's not good for young people, but for adults, it's the same as liquor. Do you have a choice? I think it should be legal compared to alcohol. Cannabis users are more calm. It would also increase revenue that we need. Alcohol should be illegal instead. Representative Okimoto, you want to take a shot at that? I mean, we have many evils in our society. Should we be cracking down on some of the more harmful ones instead of marijuana?
Well, I think Nikos brought up a great point, as well as E.T. Connors said, about the education. And I want to go back to we don't have the infrastructure for any of this, and I think both have testified to that we're not ready for it. But I am a strong advocate for properly educating our communities. And again, I just don't understand. You hope that, like Nico said, that as a mom, I'm going to make the right choices for my children. But I think it's ignorant to think that KK aren't going to get a hold of it. If the parents are allowed to do it and do it responsibly, that's their choice. But that also leaves the door open for the children to be able to access it. Since been in the House, one of the issues that have been brought up in the communities I've been in have been the great youth epidemic of vaping. And a great concern is how marijuana is laced into these flavors or these. I don't participate in that, so I'm not sure what the exact term is. But we know that vaping amongst our youth is a very, very serious issue right now. And I just see like a string of concerns that are stemming from saying, well, it's not that bad, let's just allow it. because we don't have the proper education. People are not properly educated on how this is an addictive drug. So to say, let's just start small and just manage it, I think that's irresponsible. As a former teacher and as a parent, I can't see how we can just say, let's just do a little bit and hopefully everybody will be okay when we know this product, this substance is addictive. So you get parents that are using it, the children will be exposed to it. There's evidence of how this will affect their learning and their development and their being able to grow up into adulthood. So I think that it's not that simple as saying it's not as harmful as tobacco, it's not as harmful as alcohol. You know, those have been commercialized. And I think that's a great issue as well, that when we legalize marijuana, the greatest issue is it becomes a thing to commercialize. So once that starts marketing, it becomes normalized.
Well, let me throw out, sorry to interrupt, but let me throw out,
Sorry.
I've got, no, you're doing fine. I'm just sort of like, these are a lot of questions and it's kind of getting to be a challenge figuring out where to go next. But this idea, one caller or one person on Facebook says, New Frontiers report predicting the impact of federally legal marijuana suggests the nationwide legalization could generate 1 million jobs by 2025. And then I had someone else saying, oh, it creates this healthy industry. So is there a vision, Nikos, why don't you start with this, a vision of a marijuana industry in this state? What does it look like? I mean, is it big farms employing a lot of people, generating tons of marijuana that goes to tourists and people showing up in, fancy brands of, Maui Wowie or whatever? Is that the vision for the long term of what marijuana looks like?
I think once we get to a point where the state is ready to legalize adult use cannabis, it has to be very careful in its regulations. I don't think that vertical integration is necessarily beneficial for consumers or the industry. There are also multi-state operators.
Sorry. What does vertical integration mean in terms of an industry?
Meaning that a single business entity has responsibility for the product from seed to sale of the finished product, whether it's cannabis flower or a manufactured cannabis product like a tincture or maybe an edible one day. There are also companies operating in many states like, Curaleaf and Cresco Labs and a host of others in addition to Canadian companies. And, an emerging cannabis economy here in Hawaii provides a real opportunity for small business persons to participate at every level, from the soil, probably indoor growth to the distribution, to the packaging, the sale, and to businesses, insurance. We can get a little bit more banking activity, and tourism. Let's not forget tourism once the rest of the nation gets on board as well.
Senator Rhodes,
we can become a destination for that kind of tourism.
It'd be pot paradise. So Senator Rhodes, is that part of the thinking among the supporters of recreational marijuana in the legislature that, we're not just talking about taxing, the end sale or whatever, we're also talking about jobs that could be created? Is that something that people are envisioning?
I think that's part of it, but I think it's more. I think the thing that's driving it at the legislature is the sense that this is something that is no worse than a beer, and if you're an adult, why shouldn't you be able to partake of something that it may have some negative effects once your brain is fully developed, but it's not worse than alcohol. So, but the other stuff is, especially in a time of economic hardship, the economics of it are important. But again, I don't see it being a game changer in terms of, from now on, Hawaii, half the economy is going to be producing pakalolo. I don't see that.
Well, but don't we, just at risk of sounding like an advocate, I'm just saying that you talk about economic diversification. Is that something that, it doesn't have to be half, but a tenth
I think again, you have to go back to compared to what. So right now, I don't really know where the pakalolo that comes into the state comes from. I imagine quite a bit of it is grown here, but
it probably generates some jobs, right?
So I'm guessing that it already generates some jobs. The difference between the jobs that would be created under a legal program and those that are currently produced are it seems highly unlikely that anybody's putting on their 1040. Yes, $45,000 from the production of Pakalolo. So I don't know how big what the delta is between what the illegal part of the economy would be, and if you had a legal one, it probably would get bigger, but I'm not sure it would get that much bigger.
Okay, Attorney General Claire Connors, I kind of was teeing that up for you because from a law enforcement perspective, when you talk about a marijuana industry, you probably have a very different image than from the people who support it as an industry.
Right. Well, certainly from the federal level, that's presently how the federal government regards it, right? It's still highly illegal. And if you are banking, as we've touched on, you could be engaged in money laundering, right? It's a potentially predicate offense, right? So there's a lot of concerns that are raised with respect to how we would interface with the federal model. And if you look at where we've gone with hemp, for example, with the Farm Bill, and where there's been definite changes on the federal level that have opened up our economy potentially to increased legal production, where we're trying to really work lock and step with the federal government so that we can do this in a way that's piloted and then makes sense and then doesn't create the level of confusion or a criminal enterprise under federal law, then I think that's where we could start seeing more of this conversation. But it really does have to happen on the federal level. Medical cannabis is allowed because the federal government decided we could do that, right?
Let me ask, what have you seen, and I'll let the other panelists respond to this, in terms of the illegal industry that develops alongside the legal industry in some of these situations? I recall that one of the problems that we had when we legalized medical marijuana was that law enforcement couldn't tell the difference from a distance between a legal marijuana patch and an illegal marijuana patch. And so the illegals were able to thrive a little bit better because it was just harder for enforcement. What do you see, Attorney General Connors, in terms of the development of illegal industry alongside a legal industry?
Right. Well, I think it's what we're seeing some of the other states encountering, right? And you'll see law enforcement in states like Oregon, and some of the states have been early adopters. As they have more production of legal marijuana, they're also seeing an increase in the illegal as well. And then they're also starting to see, when their market is saturated, that it bleeds over into other state markets as well. So it's not a directly, correlative conversation. I do think that when you have more of it being grown, you're also going to have more of the illegal stuff being grown too, because there's just going to be more demand, and there's going to be a very difficult task placed on law enforcement to do exactly what you just said, to distinguish what's good and what's bad. And then that gets back to the regulation, right? How are we going to do the licensing? How are we going to do the enforcement of the licensing? What's going to happen when you don't comport with your license? What are going to be the types of repercussions? And we saw some of that with the hemp bill. That was a lot of the conversation that was going on with the legislature. How are we going to make this fair so that you have an incentive to grow legal hemp and to do all the really challenging things that are involved in hemp production, because it can so readily become THC product, right? So we got to put the incentives in the right place, and I don't think they're there yet.
Nico Leveros from the Drug Policy Forum. How do you respond to that that part of the discussion, that actually a legal industry could actually promote an illegal industry?
Well, I think we see a lot of a shadow economy right now. And one of the experiences that California had with its initial startup is that cannabis was too overregulated, too overpriced. So it basically pushed people into the shadow market, and that's definitely something we have to think about. So I would think that our Republican member on the panel here would be for keeping taxes and regulations low in this emerging industry, and that we pay close attention to that.
I was actually just about to ask almost the same question, but not quite. When we talk about this, as a Republican, we expect that you would want to see a diverse economy and so on. But what do you think about this as a job generator? I want to throw out one question from a viewer. Cannabis legislation is the key to economic recovery, much like ending alcohol prohibition helped us out of the Great Depression. Not entirely sure that was what happened, but when you hear talk about a big industry like that around marijuana, what goes through your mind?
You're asking me, correct?
Yes.
Okay, yeah. I have always been pro-business, pro-jobs. I kind of wanted to just backtrack a little bit, to what A.G. Connors mentioned about, I think we talked about the black market. So I think what I hear often is that if we legalize it, then what we hear is that it'll eliminate this black market field and create jobs for our legal jobs. And the research shows that that's not true. Like A.G. Connors said, that what happens is that it increases, and so you get more illegal activity that's just getting pumped out to other states that maybe don't have the legalization of it. So I wanted to talk about that. But also when we talk about jobs, I am for diversifying our economy, of course. I think COVID definitely showed us the weaknesses of our state economy here when we were so heavily reliant on tourism. And we are suffering from it still today. But like I've said many times during this program, to me, the costs they don't outweigh the benefit. They don't outweigh the benefits, because we are not going to see the things that will happen negatively from this are going to outweigh any kind of revenue, job creation that we come to bring into our state. And for me, our KP are our future. And if we're harming them in any way, how can we say that we're doing the best for the future of our economy, for our state? And I appreciate the creative thoughts to this. I really do, because I think we need to be creative right now. But with all due respect, I will respectfully, like I always do, disagree that this is not the way to do it, that we're not ready for it. We don't have the means to do it. We're not prepared. We don't have the infrastructure. Our law enforcement is not ready for it. So we need to find another way. Okay, and I am not for taxation, correct, but I also am not for legalizing a substance that will be very, very detrimental to our communities.
Okay, let me bring up, this is a question for Senator Rhodes, and anyone else who wants to bite on it. The question is, came in by email, what percentage of our population currently uses cannabis? I have to be honest, when I look at this array of questions I get, it's a very unscientific survey, it seems like most of the people who are calling us are supporting decriminalization, at least, or legalization of marijuana. But what's the politics at play here, Senator Rhodes? Is there pressure on the legislature to do this just from people who like marijuana and want to see marijuana easier to get and legal to get? Is it votes? Are there votes there around this issue, and which way would they fall?
I think there are votes. I think the building meaning the Capitol, is behind the population, the electorate, in terms of what they think we should be doing with Pakalolo. I think I've seen polls that say that 60% of people support recreational Pakalolo in Hawaii. Anecdotally, it's hard to know, because it's an illegal right now. It's basically illegal unless you have a medical marijuana card. But anecdotally, I have knocked on probably tens of thousands of doors over my political career, and I smell Pakalolo smoke probably multiple times. I never really sort of tried to keep track of it, but I would say every day that I knock on doors I represent very wealthy neighborhoods way up the mountain in Nuuanu Valley, all the way down into Chinatown and in Palama. I smell pot everywhere. And I just, I disagree pretty fundamentally with the Attorney General about the availability of it. It's everywhere. And I think because of that, if enough people do something like that, it does become a political issue. And I do think the building is behind the general population in terms of whether it should be legal or not.
Attorney General Cotter, since he referenced you anyway, you are a law enforcement official, but you're also an appointee of a government. What do you see as the politics at play here? Do you think that this is such a popular issue that at some point it's just going to happen? I mean, what do you think about that?
Well, we've been prepared, right? So yes, as I've raised, we have these law enforcement concerns, and we have testified in that capacity against decriminalization, not just per se, but because of the effects it has on the entire criminal justice system as well, and want to be sure that we're thinking through all those different implications on victims and on resources for rehabilitation and treatment and things like that. But in terms of the policy side, I think where we go from here is we really need to drill down on what we want it to look like and how we want it to be managed in our state. And the 15 states, or the handful of states that have done it, they have in California, there's a California Bureau of Cannabis Control, right? There in Alaska, it's the Alaska Marijuana Control Board. In Nevada, it's the Department of Taxation. And I know there's a bill up there that places that in our Department of Taxation this session. So we just need to think through the impact it's going to have on the agencies, how it's going to be regulated, and all the different concerns that Representative Ukimoto has raised, and even Nico has raised as well, about how are we going to teach people about dosing? How are we going to teach people about impairment? How are we going to teach our law enforcement to discern and to change the way they approach keeping people safe on the roads and in the community? And it's a very, very detailed conversation that is going to impact how we move forward as a state and what we look like as a state. And I think we need to think through what the government structure behind it is going to be.
You know, it's interesting to me what I'm hearing you say, and you correct me if I'm wrong, is if the legislature passes this, give us plenty of time and resources to work it up. But we're not gonna stick our heels in and fight this tooth and nail if the legislature passes this. Ultimately, the governor would have to decide whether he's going to sign it or not, which I imagine you would advise him on that. But it sounds like you're thinking a lot about this being a reality, if not this year, someday.
My office is, because we represent the different agencies that would be impacted. So I have deputies in my department who advise the Department of Health. And so they work a lot with the medical cannabis program and try to work through those issues. We have deputies who advise the Department of Agriculture that's been working through a lot of the issues created by hemp. And then, of course, we work with DCCA and we work with the Department of Taxation. And then, of course, this is going to impact our workplace as well, right? If we start having people who are impaired, we need to figure out how that's going to mesh with the federal workplace safety laws and how all of that is going to affect how people are going to be interacting with each other as well. So it does, on the task force we've created in our department, we have our labor attorneys involved as well. So we, as our legal officer role, have been looking at this so we can, as best possible, advise our agencies, advise our legislators, if that's where they're taking us on a policy level. And that's setting aside, again, the policy concerns in our law enforcement capacity that we do raise and that we do think also are a concern that have to be addressed.
Okay, so we got about, I don't know, 8 or 9, 10 minutes left here, so.
Daryl, could I quickly interject?
Yes, but I do have
A
a
growing
question for
number
you
of public
right after that.
officials outside of the Capitol have endorsed adult use cannabis, including the Maui County Council, the Kauai prosecutor, and even AG Connors' predecessor, Doug Chin, has come out in favor of adult use legalization. So yeah, there are a lot of issues to be worked over. And what we've seen in terms of number of people using, according to the Youth Risk Behavior Survey, rates of high school use has decreased from 22% in 2009 to 17% today. And in 2019, the CDC issued a report finding that youth rates declined after legalization, including in Colorado.
Okay, Senator Rhodes, let me ask you, the legislation that's being envisioned is part of the thinking along the lines of this question from Britt in Kaimuki. Wouldn't legalizing cannabis make it easier to control what's mixed in with it, for example, edibles, butter, easier to study since people won't hide their use, make more jobs from farms to store, example? Okay, but anyway, this idea of, yeah, it's everywhere, but does it need to be regulated and brought out of the closet in order to make people safer?
Well, I think it does. I mean, you don't. Most of the stuff that we put in our mouths and eat or drink these days, there's safety checks. You know, you go to the grocery store, you buy stuff, it has a sell by date. You have a pretty good idea what's in there. Now, even that system messes up sometimes. But you know, if you're an illegal drug dealer and you figure out a way to put something in there that's not Pakalolo, or that's cheaper to supply, if you can get away with it, great. Or if you want to mix it with something else that's harder, you might find that people find that more popular too. But there's no real restriction on it. There's nobody really looking. There's no agency that you have to run that through to be sure that what you put in is within the tolerance ranges. So yeah, I would say that if it was legal, you're going to get a safer product.
Let me ask though, do you picture legalization basically just being a cottage thing where people just grow their own for the most part? I mean, or do you see it being an industrial thing? Would you let people grow their own and share with their friends as opposed to having a taxable regulatable industry, Senator Rhodes? I mean, what's the picture
I
there?
think it's likely to be both. I mean, if you want to grow, you can grow, and just like you can grow a garden and grow tomatoes if you want to, instead of buying them from the grocery store. But if you look at the tobacco companies, these of course are huge multinationals, and depending on how you want to look at that may be a danger of legalizing Pakalolo, that all the mom and pop operations will be pushed out of business by the RJRs of the Pakalolo world. But yeah, I think it's quite likely to be corporatized to a certain extent.
Nico Leverett, what's your image of how it would work in that sense, the homegrown versus the industrial side?
Going forward, we stand firmly for the right for people to grow their own cannabis in limited quantities. We also have to protect the rights of patients and care providers under our current medical cannabis laws. And I think regulators and policymakers have to be very careful in protecting Hawaii's market from basically a large corporate invasion from the continent and from other countries, because there are companies out there that have market capitalizations in the billions of dollars right now, and that will only multiply once the federal government gets its act together and takes cannabis off Schedule 1 and allows banking services. So Hawaii has work to do, but I'm confident that with folks like Representative Okamoto and AG Connors and Senator Rhodes, that something to spread the wealth of the emerging cannabis economy can be a reality. Like we have a blossoming craft brewery scene here now, so that should be a rough model.
Now let me throw out one more question. We've only got about 3 minutes left, so this might be too big an apple to bite into right now. But the question is, alcohol and smoking harms kids, and those are legal. I don't see you. This references Representative Okimoto, but I think it's more about the more traditional thinking legislators. I don't see you going after those. Is it because those industries are too big? Kind of hypocritical to say marijuana is worse than those two. And rather than put you on the spot, if you want to answer that question, but I'm just wondering, for anyone on the panel, how much power, or is there a pressure from the alcohol and other vices not to approve recreational marijuana because it'll affect their business?
I think, I wasn't there when those things became legal. So even when medical marijuana came to the legislature, I was not there. So for me, I've always been one where I vote my conscience, I vote what I believe, and I vote to represent my district, as I did with the decriminalization of marijuana. But I can't speak for what happened with alcohol or tobacco. I was not there to place a vote on those. It's law now, so I follow the law. That's my responsibility. But for me, I just wanted I was with a bunch of third graders today via Zoom, and they asked me what my favorite part of my job is, and it really is connecting with my district. And for the past 2+ years, I've asked my district, the people who vote me in to represent them, how they feel about this, and they're in opposition of it. So, as Senator Rhodes shared that his district is a little bit different, where he smells it as he walks through the door. My district is different, and so I think there's, we're not gonna have the same districts, but I am put into this position to represent the people that have chosen me to represent them, and I hold that responsibility very. I carry it dearly, and I want to represent them properly. So when my district is telling me that they're in opposition of this, I know that not everybody feels the same way. When the majority feel that way, I have to represent their voices.
Okay, Senator Rhodes, you're the more experienced politician. You've been counting votes for a few years. Is this something that's really going to happen this year? I mean, tell me what you think is going to happen. You don't have to do it in 2 words, but in a minute or so. Yeah, what's the realistic possibility of this passing?
I think it's unlikely. I think in the Senate, the votes are there. The Senate, I think, tends to be a little more, well, I don't know if liberal is exactly the right word, but there are certain issues that it grasps quicker, I think is fair to say, and I think the votes are there pretty easily. The House, I don't know. I was in the House for 10 years. I was the first committee chair in the House to actually hear a legalization bill, And I was told by the next committee chair that would get it if I had passed it out, that, well, you can pass it out of the Judiciary Committee if you want to, but I don't have the votes to pass it out of the next committee. So I didn't bother to go forward because, there's opportunity cost there. But so I would say there's a pretty good chance something will pass the Senate. I would say that odds are significantly less in the House, and that's just, educated guess.
Well, you also made the point that there may be more money coming in, which will reduce the incentive for it to be a cash crop.
A little, but as I also said before, I don't really think that's the driver. I think the driver for this issue is that people feel like, hey,
I got to stop you. Sorry, Senator. I used up the minute. So thank you very much, all of you, and mahalo to all our viewers for joining us tonight. And we thank our guests, State Attorney General Claire Connors, Democratic State Senator Carl Rhodes, Republican State Representative Val Okimoto, and Nikos Leverance, Board President for the Drug Policy Forum of Hawaii. Next week on Insights, we'll get the latest on the state's battle against COVID-19 from our leaders in charge of the effort. We'll talk everything from vaccinations and variants to easing more restrictions. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.